My name is Charles Alessi. I'm Chief Clinical Officer of HIMSS, and I'm here in Istanbul at HIMSS' Eurasia. And I've got with me Sonia KHAYAT from the Tunisian Ministry of Health. Hello, Sonia. Could you tell us a little bit, Sonia, about what's happening in Tunisia and what the healthcare like is in Tunisia? Because a lot of the people who will be watching this probably wouldn't be very aware of it.
Thank you. In Tunisia, like in other countries, we are facing a lot of challenges in healthcare sector, like the increased age of population, the burden of chronic diseases. People are getting diseases at early age, and most of them don't know they are sick. We have the regional disparities, shortage of physicians. Most of the hospitals are on the coast or in the urban cities. Also, we have a lot of problems with financial funding, financial constraints because of the increase of cost in health.
This is really, I'm sorry, I've just had to, what you've described is the problems of health globally.
Yeah.
Increasing populations, of increasing age, increasing multimorbidity, financial difficulties in actually managing that population, inequalities in healthcare delivery, problems with workforce. It's the same story everywhere. Yes. And in many respects, you're luckier than some countries, like Japan, which have a super aging population. You haven't quite got there yet. Your population hasn't aged as much as they have. But you are in a good place. You have an educated workforce, well-known place in terms of medical expertise. So really the challenges are more for you, I think, around getting your health systems organized. Is that the case?
Absolutely, you are right. And today we have to think about modernizing our health system, because we cannot keep the way we've done it for years. In the era of digital transformation, and in the era of where the consumer is too demanding, we have to think about about experience that has been done in other countries. And today I'm really glad to be here, because it is an opportunity to see what's going on, especially the experience. I'm impressed about the experience in Turkey. In only 1 year, they achieved the level 6 of 167 hospitals, and the 3 hospitals for 6-7. I'm really amazed, and congratulations to the Ministry of Health in Turkey.
I think the speed with which Turkey has done this is fantastic. You're quite right. The challenges, as you described them, I think are the same everywhere. Digital transformation is not easy. Physicians like me find it very difficult. The population also needs it. One needs to bring the population with one. It's not that straightforward, and you're clearly down this journey. So your biggest new schemes that you have in front of you, what are they? The biggest transformation schemes you have in Tunisia?
Absolutely, we have a lot of new schemes to be developed. The primary healthcare has to be the first entrance to the health system. We have to family medicine. We are in the process of how to do it, and also the shortage of physicians. We want to use technology like radiology, telemedicine, because we want to reach all people wherever they are in the country. Today there is an escape of physicians abroad, and there are scarce physicians in many regions, and the connectivity continues.
True of everywhere.
Yes.
As well. Primary care, of course, I was a primary care physician. I was chair of the British National Association of Primary Care. So I'm a primary care person. There are going to be less and less and less of these people in the future, I think. We all know our workforce is getting smaller.
Yes.
So our solutions have to be technology,
Yes.
as you described.
Also, the package of health services, it has to be for all people to reach the universal health coverage. It has to be defined and for all people. We need to have a unique insurance scheme,
Yeah.
because today it's fragmented. We have three different schemes. We want to have a unique health insurance for all the people, either they are rich, poor, or vulnerable. We want the digital transformation. So the big challenge, we have to set up connectivity. Not all of the healthcare facilities are connected, so we have to think about the network, the infrastructure, how to develop an information system that supports data-based evidence, shareable on real time and centered on the patient. We have to do it as soon as possible. And also information history, democracy. We have to, people have the right to access wherever they are with quality and security.
And there are some wonderful systems out in the world for you to see
Absolutely.
around how that's been achieved.
Yeah.
But you come from the place, your previous experiences were around the management of surveillance systems, certainly in public health. How well developed is the system in Tunisia?
Surveillance. We do have a surveillance system, but it's not integrated and not comprehensive. I believe that if we set up now, we create a comprehensive, integrated global information system with all stakeholders, with health, health diplomacy, health in all strategies, we can improve the state of the art today. That's where we are. We have, as you said, we have very good practitioners, physicians, you name it, but we need more organization, and that's the role of digital transformation.
So, Sonia, you're in a wonderful place. The task is enormous, but it's no bigger than it is in a lot of other places. And my aspiration is that HIMSS will be there with you to assist you in this process, to really bring the benefits of digital health and transformation to all the citizens of Tunisia, to be able for them to have the best health possible everywhere they happen to be. Thank you very much for this opportunity.
Thank you, Charles.
Thank you.